If you've had an injury to your hand and arm and you've had surgery, one of the most common questions I get is, when does the swelling go away, Huang? So whether you've broken your finger, your wrist, your elbow, one of the and you had surgery, right? You broke something and you had surgery. When does the swelling go away? So the quick and dirty is the swelling is the last thing to go away, right? So let me explain. My name is Huang. I'm an occupational therapist and certified hand therapist, and I treat a ton of different post-surgery cases. Usually that means something is broken, something is torn, and you had to have surgery to put it back together. And so then what we're dealing with is an injury from the injury and then a second injury from the surgery itself. And then what you're left with is a stiffness, swelling, and scar. One of the most common questions I get is, when will that swelling go away? And it's because people tend to think, if the swelling goes away, then I'm going to move better and then my scar is going to be softer. But that's furthest from the truth. You actually have to do all those other things first, and then the swelling will go away. And believe it or not, I've worked with people with knee injuries, with ankle injuries. It's the same deal. My mother-in-law is actually having knee surgery. Oh, well, she had knee surgery 2 months ago. She had a patella tendon rupture because she fell, and they had to sew it back together. And I was working with her over the weekend, and she had the same questions. I said, let me just bring it to everybody on my YouTube channel so you can know what to do. So you have an injury that hurts you, that causes swelling, and then you have to be immobilized, right? They probably put a splint or a sling or a brace of some sort until you can go and have surgery. Now, depending on how severe it was, you can have surgery that same day, or you might have had to wait a week, maybe two, if it was, couldn't find anyone to come in or whatever. But the waiting time, you also had to stay not moving, right? Because it was broken, torn, cut, something like that. So specifically in the hand, right, you can have any kind of injury to your fingers, your hand, your wrist, your elbow, any of those things. The swelling tends to start to pocket down your arm. It's not quite the same for a shoulder, so that's why I'm not including it. But if you can think about how you stand and how you move, your hand is always hanging, right? So even if you were to be like, oh my God, I'm gonna hold my hand high up to my heart, then what happens is you kind of block it right here. You kind of, if you can imagine like a hose of water, it gets kinked right here. So if you leave it locked, and you're gonna essentially like hold that swelling in the arm. So when people are concerned and ask me that question, well, when is swelling going to go away completely? And I tell them, it takes, it's one of the last things to go away, and it can take up to a full year. Now, wait, don't click off. Hear me out. I'm not saying that you won't get small incremental amounts of improvement. Of course, you're going to get amount of improvement, but for the swelling to completely be gone, it can take 9 months up to a year. I had a patient, she had a distal radius fracture, and she was a skinny little thing, but she was so concerned about her swelling because she loved to wear jewelry. So she came, back in the day, I used to work at Miami Beach. Now I own my own clinic. I don't know if I mentioned it, but I own my own clinic, hands-on therapy services, located in Doral, Florida. But back in the day, I used to work at Miami Beach, and I had this cute little lady come in. She would travel every year from Israel, and she would visit her family on the beach. Well, the poor thing fell and broke her wrist, but you could hear her coming a mile away because she loved wearing her bangles. She loved wearing her jewelry. And she was so concerned after the injury and after the surgery that her swelling would not go down. And she loved to wear her watches and her bracelets. And she's like, do I have to size everything? And I was like, no, you don't, Mrs. Brooks. She actually did very well after her distal radius fracture, and she was able to move it really well. After 3 months of therapy, she had great range of motion, no pain, but that swelling still kind of stuck around. So I told her, Miss Brooks, go home, ignore it, do everything you're supposed to do the exercises we gave you, move around, and don't go and change your jewelry at all. Give it a year. Whatever you are at a year, then that's the swelling or that's the thickness that you have now. You know, a year later, I could hear her. She comes down the hall and I could hear her jewelry jingle. And I was like, is that her? Because she would come over every year. So I think it was the summertime. She would come over every summer. I'm like, I think that's her. Sure enough, she came through my doorway and she was like, do you hear it? Look at my wrist. It's all gone. So when I do have a chance to follow up with my patients that have had some of the most severe injuries, their swelling does go away completely. I had a guy, he got his hand stuck in an extractor fan. Do you know what that is? Yeah, well, it sounds as terrible. I mean, it was as terrible as it sounds. His hand got stuck in an extractor fan. He lost part of this finger, broke this metacarpal bone, and I think he broke this finger too. I don't know what happened to the small finger, but he pretty much broke up his hand, lost part of his finger. And let me tell you, I saw him years later. I saw him, I think, 1 or 2 years later, and then I saw him 5 years later. And he had, well, you don't recover your finger back, but he had great motion, and all his swelling was gone, and his scar was much softer. I saw one of my patients, he was in a car accident, completely mangled up his hand, and he had like several surgeries. And he was in a car accident. He fell asleep at the wheel, and his car went underneath a like an 18-wheeler truck, and he was lucky. Like, I guess he went like this and his hand got messed up, but he was lucky to be alive. Let me tell you, again, a couple years later, no swelling, hand looks really great. I mean, not 100 with these most severe accidents that I'm talking about. Even though they don't fully 100% recover because of how severe their accident was, they didn't have swelling. They were able to move and use their hand. My distal radius patient, she came in and she was like, look, I did what you said. I didn't change. I didn't go get everything resized, and it fits me like a glove, like it fit me before. If you're concerned about that swelling, it will go away as long as, right, there's something you have to do, right? The swelling will go away fully, right? Swelling. Give yourself 12 months, right? Honestly, give yourself 12 months. Within those 12 months, right, you have to do something. You can't just not do anything and expect like, oh my God, it's going to get better. You want to get full range of motion. Full range of motion. That means whatever you're capable of getting, you want to get. And what I mean by that is you should be able to push on it. If you're broken or dislocated right here, you should be able to push on it, and you should not feel pain. That is what we call end range pain. If you still have that, then this is why your swelling keeps going up and down, up and down. It's because your body is trying to tell you, I need it to be fixed, right? I need to be fixed. So I get comments like that all the time, like, oh my God, it's been like years. Well, your body needs to be fixed. So your swelling, you keep kind of like doing what we call micro injury, just little injuries, little irritations. And so it keeps swelling up and it goes down, keeps swelling. So anyway, fix that shit, and then your swelling will go away for the most part, right? You want full range of motion. You want that joint to move. If you have a scar, you want to fully move scar, right? So scars can limit motion. Scars can also pocket swelling depending on how big and how severe it is. You can like kind of pocket everything. So for example, this knuckle, your big knuckle, we have your big knuckle, right? We have ligaments in between that kind of, they're like little buckets, right? So if you don't move these big knuckles, you can essentially like hold that swelling in there, right? You kind of like hold that swelling in there. So if you don't fix those problems and get full range of motion and move that scar, you can essentially like hold that and limit that when it comes to swelling. So move those and get full motion, and then you're gonna get rid of your swelling. Now there's two types of major swelling. We have what's called like pitting edema, and then brawny, right? So pitting edema is like that puffy edema. It's that puffy swelling. So swelling is a terminology like most people know, and then some people come in and say edema. Edema is the more medical terminology for swelling. So the kind of swelling that people tend to get, sometimes in the back of their hand, sometimes around their wrist, sometimes around their elbow when they have an injury. Like my mother-in-law, her swelling doesn't stay at her knee too much. It moves down to her ankle, right? Because gravity's pulling everything down. Why wouldn't it pull the swelling down? So when you touch something and it squishes and it leaves an indent, we have pitting edema. The kind of swelling that you sort of want is a swelling that comes and goes, comes and goes. That's the pitting edema. When you have swelling that comes and goes, comes and goes, you can make it go. And over time, you can make it gone, right? When we have brawny edema, it's the edema that sits there and it stays and it just feels real thick. Well, brawny edema starts to become like basically a lot of what we call fibrous tissue, and basically it's like scar tissue but deep inside. So sometimes you see a cut and you're like, that's scar, but we can have scarring that's deep inside, and the medical terminology is like fibrous tissue, whatever. I just call it scarring but deep inside. I just keep it real simple, but the fancy word is brawny. So how do you know it's brawny? It's just thick and it's hard, and we tend to see it in the fingers. You don't want to see that in the fingers, right? Usually if you have a lot of that, it tends to mean that you're very, very stiff, right? So those are the two types of edema. Ask your therapist. If you're working with a therapist, ask them. Ask them about, what they can do about the swelling, and ask them how they can help you. So this is how I explain it to my patients. My mother-in-law, I'm saying the same exact thing to her. My patients that come into my clinic, this is how I describe it. But if you want to get rid of it, if you want to get rid of your swelling, you have to move, and you have to move that scar. You have to move your joint, and you have to move that scar. But don't worry about the swelling. You don't want pitting edema, because the swelling, the longer it sits, the more it becomes brawny and the more it becomes fibrous, like all that scar tissue. So you want to be very proactive, right? I always say the first 3 months after you have a surgery, go to your therapy. Don't be scared of it. Try to get the swelling moving as much as possible, a little bit at a time. You're like taking a bucket, chucking it out, taking a bucket, chucking it out, right? That's how I think about swelling. And you want that swelling to like move out and stay out. And your first 3 months is like your biggest opportunity. So don't waste that time thinking, I'm just gonna wait until I move better, and then I'll get the swelling down. Or I'm gonna, let me wait until the swelling goes down, and then I'm gonna start a move, and then it will feel better. No. Everything is happening all at the same time. You're gonna move, get the swelling down. You're gonna move the scar, get the swelling down. Swelling's gonna come back in, you're gonna move again, and you're gonna move that joint and move that scar. So there's a lot to do, but it's possible for you. It's totally possible for you to get rid of that swelling. The worst thing that majority of the time people do is wait, because they're scared, they're not sure, and the waiting tends to make everything so much harder. So save yourself, save your therapist some time, save yourself some time. Really, it's you. You can come here and be with me forever if you want, but most people don't. Most people want to get better and then, come back to me whenever they need later. So I hope this video helps. My name is Huang. I'm an occupational therapist, certified hand therapist. And if you have any kind of hand or arm injuries and you're just not really sure what to do, give my clinic a call and we can help you. If you don't live in the Miami area, find yourself a certified hand therapist if you have any hand and upper extremity types of injuries. But until then, let me know how I can help you. Click the like button, subscribe, leave me a comment if you like, if you have any other questions. All right, I'll talk to you soon.